Hi, I'm Dr. Akiba Green. As a board-eligible clinical nutritionist, chiropractic neurologist, and board-certified integrated medical provider, I see patients every day who suffer the effects of food and chemical sensitivities, oftentimes the result of genetically modified foods. The most common patients that I see in my office suffer from autoimmune diseases. Those include thyroid disease, diabetes, peripheral neuropathy, irritable bowel syndrome, colitis or celiac disease, fibromyalgia, even MS, Parkinson's, ADHD, or other disorders. I treat my patients as a whole person, not a subspecialist. Now, what I notice is that none of my patients have just one thing wrong with them. Physiologically, it's an impossibility. They have what I call a web of physiological dysfunction. It's a myriad of problems leading to their symptoms. One of the most common problems we see with these patients is food sensitivities, specifically immune reactions against wheat or gluten, dairy, corn, soy, even coffee, and often other grains such as rice, even potato, quinoa, millet, or buckwheat. Now, the reason for these sensitivities often lies in the fact that the foods we eat are not the same foods we ate 50, 30, even 10 to 15 years ago. In fact, many of the foods that we eat today did not even exist 20 to 30 years ago. Now, we're here talking about genetically modified foods, and when we talk about these foods that people have reactions against, I want to talk about just a couple examples. The big one, soy. When we talk about soy, and it's in everything, and I can tell you if it's an ingredient, it's probably genetically modified. The proteins are not recognizable by the body. They can even lead to brain cancer, according to the British Medical Journal. Corn is another huge one. Now, corn that animals eat is not the same corn that humans should eat, but believe it or not, it's often what's fed to us none the same. It's different. Literally, it's not the corn that our body likes to break down, and that comes into the even bigger one, which is wheat. Now, when we talk about gluten sensitivity, we're talking about gluten that is not the way it was. Our wheat, again, is changed. It's not what we ate 50 years ago. It has been genetically modified. The U.S. government does not use that term. The rest of the world does and has outlawed genetically modified foods for a reason. Gluten sensitivity has been contributable to 55 diseases, according to the New England Journal of Medicine. They make gluten more water soluble. It causes our body to not recognize it properly. It's a process called deamidation. Grains are also stored in bins for long periods of time, leading to enterotoxin contamination. And then you know what? These grains that have been there for 2 to 3 years on average come to the store and they put preservatives on them so they taste new and fresh. Autoimmune gut dysfunction associates with gluten sensitivity, celiac disease, and other genetically modified foods. The key thing is if we don't change our farming behaviors, if we don't stand up to the GMO conglomerates, if we don't demand more from the FDA, the USDA, and our government agencies here to protect us, it isn't hard to realize what's going to happen to our health and wellness in America. Thank you.